I am the public health officer from Marin County, so I thought I'd just sort of help people understand what that actually means. I am a public servant, so I work for the government. Your taxpayer dollars pays my salary. I serve within the Department of Health and Human Services, so I serve at the pleasure of the Board of Supervisors. And I grew up in Marin County. I grew up in San Anselmo. I moved here when I was 1 year old. My dad got a job at San Francisco Theological Seminary. He was a minister and a theologian. So I grew up in First Pres San Anselmo. My mom was organist and choir director there for a while. And I share that with you because I think it's a piece of my upbringing that I'm only starting to realize, even this late into my career, how important that was in terms of my formation as a health officer and how I think about health and well-being. Certainly that background of growing up in a faith-based family, while I don't wear my faith on my sleeve in my role, it is still really an important informer of the work that I do. And just having that ethic of service from I would say, more sort of liberal Christian perspective of inclusivity and the dignity of every human being has been an important driver for me throughout my career as a physician, and indeed it was a calling. For me, that calling came a little bit later. I started medical school when I was 30 years old. I mean, it took me a while to sort of find my way there. I didn't feel academically prepared to actually go to medical school. I was intimidated by some of the curriculum, but I really felt like the most important determinants of well-being really were in health and healthcare, and were experienced at the community level. And I wanted to dedicate my life to improving the health at the community level. And so that, I moved back to Marin 11 or 12 years ago with my family, and Marin is a very interesting place to practice public health. When I came back to Marin, I had been working at the CDC in Atlanta doing international tuberculosis research. Came back to Marin to raise a family in a place that felt like home, even though I had been away for about 30 years. And took a job at Marin Community Clinics, one of our federally qualified health centers, as a primary care doc, and really got to see kind of just on the front lines the disparities that we have in this community, despite it being such an affluent community, really in the lives of my patients. So 1 year later, when I became health officer, it was really clear that I knew that I was dealing with sort of this paradox of a very affluent and healthy community on the surface, but actually with what large disparities. And as an epidemiologist, always looking to the data, I'm going to share with you some of the data that I think will help sort of organize this conversation. So Marin is, every year, every county in the United States is ranked by the Robert Wood Johnson Foundation as how healthy it is compared to other counties in their state. So there are 58 counties in the state of California. Marin has been ranked the healthiest county in the state of California 13 of the last 14 times that's been measured. So we are generally regarded as the healthiest county in the state of California. We have the most important metric that they use for ranking counties is life expectancy itself. That is how long people can expect to live in that county. Marin is about 85 years life expectancy. In the United States, life expectancy is about 76 years. So we're an outlier where it comes to life expectancy. That's one of the points of pride of Marin. One of the points of shame in Marin is that we also have some of the largest differences between communities in Marin. So the variability around that average is some of the highest. In Marin City, life expectancy is the shortest of any community in Marin County at 77 years. So about 8 years shorter than the average, and about 15 years shorter than a community that's only about a mile away. Sausalito, Waldo Point, has the longest life expectancy of any community in Marin County at about 92 years. So that's right off the bat, sort of an invitation for me as health officer in this community to take a deeper dive. To first of all, I guess that's the first question is that acceptable? That's the data, right? That's just a data point, right? It's up to us to make meaning of that, to decide whether or not we think that that's acceptable. And if we don't, then what to do about it. And I think that's really where my department and my team have been working with our partners in Marin City and across the county to try and actually address those unacceptable disparities. So we were talking about what is the definition of health disparities? That's the definition of health disparities, right? It's differences in health outcomes within groups. And we name it as an inequity by applying a lens of justice. And we see this as a form of social injustice or unfairness that some communities, some people, just by virtue of where they are born in a given community and the community that they are growing up within, may not have the same opportunities for healthy and long life as people who are born into other communities.